There is no sound.
I can hear.
I can hear.
I can hear.
Welcome. Audience members must raise your hand electronically if you have a question during a breakout session. We will not be answering questions in the chat. To raise your hand, look for the reactions icon. Click on Raise Hand. When you are called on, unmute yourself. Please only ask a question. Do not make a comment. After you've asked your question, click on Lower Hand. You will not be called on again until others have had a chance to ask their question. Please remain muted unless you've been called on to ask a question. In order to see a speaker clearly in a breakout session, please click on View in the top right corner of your screen. Then select Speaker from the drop-down menu. To see the ASL interpreters or for tech help, please return briefly to the main room. Illinois teachers may sign in and out of each session for 1 hour of credit. Use the QR code or the link in the chat.
Jean, do you want to put the professional development slide up?
Are you ready to begin, Jim?
Sure. So let's get started. This is the session entitled Gun Violence as a Public Health Issue. We're taking a little bit different approach to the gun violence issue by posing it as a public health issue. Our speakers are Lauren Harper, who is legislative lead for the Illinois Moms Demand Action, Sara Knizhnik, who is chair of the Lake County State's Attorney's Office for Gun Violence Prevention, and emergency physician, Dr. Halleh Akbarnia. So we're going to get started with Lauren. Lauren Harper is going to go first. And Lauren, go ahead and share screen.
I'm going to actually share the screen for everybody. I've got all the slides, Jim, if that's okay.
Oh,
make it a little bit easier, I hope.
Yeah, okay, go ahead.
I'm going to share my crazy desktop.
Okay, and then also I keep on unmuting myself, but then getting muted again. I think I'm good right now though.
Let me know if you can see the whole screen.
Looks good to me. Excellent. Okay, awesome. Hi, everybody. I'm Lauren Harper. I'm the state legislative lead for Moms Demand Action here in Illinois. And I'm just so pleased to be here with the League of Women Voters. We've done a lot of great partnering over the last few years. So it's great to be here. I think oh wait, you might have skipped something there, Halleh. Can you go back a slide?
It just did it on its own. Let me go back.
Okay. That's okay. I'll just
Hold
keep,
on.
I'll go through it. I'll
Oh,
just
wait.
keep talking. Yeah,
Okay.
so I think what I would love to start by doing is giving you guys sort of an informational overview, and then a little bit of a strategic overview. This is going to feel a little bit like a word wall or a data dump. And part of the reason that I want to start with all this information is I feel like for the last few years, we suddenly have this huge amount of information that's sort of, populating our minds, and it's giving us the ability to talk much more smartly about the gun problem in the United States. But it's coming on the heels of decades and decades of us living with no information. And that was by design. The NRA lobbied to make sure that we didn't have data to use to help legislate good gun laws. So let me just start by giving you some really basic facts. Americans, since the Sandy Hook shooting 10 years ago, have purchased over 150 million guns, bringing the estimated total of guns in the United States to over 420 million. And I like to start with this because it's the world that we're going to live in today, and it's the world we're going to live in next week, even if we pass every single gun law that we want to pass. So we have to figure out how to live responsibly with 420 million guns, which is a huge, tall task. We now know that in our country, 44% of adults report living in a home with firearms. And this is a staggering number. I hear this and I still can't process it, but 54% of those people don't lock up their guns securely. Within the language of Moms Demand Action, we talk about secure gun storage as meaning three things. The gun is unloaded, it's in a safe, and it's separate from ammunition. So it's not an unreasonable high bar. It's just that's the way we think of secure gun storage. What we know is that during the pandemic in 2021, 20% of the guns that were sold were to first-time purchasers. And what that means is many of those people didn't go through any firearms training, and likely they did not purchase a safe because it was during the pandemic. Which means now, this is a data point that I'm sure you have all heard, gun violence is now the leading cause of death for children in the United States, which is just unacceptable. Unfortunately, the picture in Illinois is perhaps even more bleak because specifically in our state, we actually purchased 24% of all of the guns that were sold in 2021 in the whole United States, but we only make up 4% of the population. So we're leading in all the wrong ways here. So you can go to the next slide. When we talk about the problem of gun violence in our country, it really is a public health crisis. And I think it's important for us to start by debunking some of the myths that we've been fed for forever by the NRA, specifically the idea that more guns make us safer. So again, now that we finally have some data out there, there was a research study that was completed by Stanford out in California. It was one of the broadest, biggest studies that's ever been done. It was 26 million people over 12 years. And they tracked people with firearms and without firearms. And they also tracked when they obtained firearms. And they found very clearly that the presence of a gun increases the incidence and the lethality of suicide. Men who own handguns are 8 times more likely than men who don't to die of self-inflicted gunshot wounds, and women are 35 times more likely to die. Women now make up over 50% of new gun purchases in the last few years, so that's particularly notable. And it's also important to point out that 6 out of every 10 gun deaths are suicide in the United States. So this data helps us inform where we take our legislative priorities, because safe gun storage and the need to educate our law enforcement about things like red flag laws and firearms restraining orders is extremely important. So you can go to the next slide. Right, so what do we do about this? We really do need to educate people. So firearms restraining orders are tools that allow family members and law enforcement and courts to temporarily remove guns from individuals who may pose a risk of harming themselves or others. And again, going back to data, these types of laws in Connecticut in particular, which was one of the first states to implement these laws, researchers estimate that for every 10 to 20 risk warrants that are issued, one life is saved. So they're only as effective as if the public knows about them and if law enforcement knows how to implement them. So one of the things that Moms Demand Action has been working on quite a lot for the last few years, since 2019, is working with police departments and with schools and public health officials to educate on how these laws are implemented. It's important to note that the Illinois State Police has actually issued fewer than 250 of these FRO petitions compared to over 9,000 in Florida. So again, they're only as good as whether or not we know how to use them. So you could go to the next slide, Halleh. Thank you. Unfortunately, the problem is even more acute for teens and tweens. About a week ago, the CDC released an update on data that was just shocking and sad for teenagers. 42% of teens are reporting feeling persistent hopelessness and sadness, and the picture is far worse for girls at 57%. 22% of students have seriously considered suicide. That number goes up to 30% for girls. 18% have made a plan to commit suicide in the last year, and 1 in 10 teenagers have made an attempt of suicide in the last year. These are bad numbers. What we see is that the intersection of the proliferation of guns and this decline in mental health has resulted in a 53% increase in the suicide rate among young people in the last 10 years. And the reason we focus so much at Moms Demand Action on safe gun storage specifically is that teen suicide is very impulsive. We know that teenagers' brains are not very well developed, and specifically with a firearm, method matters. So when I say that, I mean that if a gun is involved in a suicide attempt, it is 90% or more fatal versus less than 4% if a gun is not involved. So if we go back to that number that we heard before, 54% of people not locking up their firearms properly, we know that there are millions and millions of kids in the United States that are living in homes with loaded and unsecured firearms. One of the things we hear most about in the news is this proliferation of gun violence in schools, mass shootings in schools. This data was presented a year ago by the Washington Post, and then it was updated again yesterday. And what you're looking at on the right here is since 2000, each one of those clusters is a school shooting. And each tiny dot within a cluster is 10 children that were impacted by the school shooting in the larger cluster. What we know now is that 338,000 students have directly experienced gun violence in their schools specifically. This doesn't take into account sporting events, things that happen in the parking lot outside their school, movie theaters, any of that. This is just within the school. And what it doesn't really show is the long-lasting decades worth of trauma that these kids experience as a result. So you can go to the next slide. Again, where do we go from here? One of the most important things we try to do at Moms Demand Action is work locally to normalize the discussion on safe gun storage. So we work really closely with our schools to help them understand this, the importance of safe gun storage. What we know is that reducing kids' access to guns is the simplest direct line to reducing these shootings. Kids are actually committing more than half of the school shootings in this country. And they're all getting, well, 86 or more % of them are getting their guns from home or the home of a friend or a relative. And the median age is 16. We spend $3 billion annually on security measures to improve the school and, you know, entrances into the school. And we don't really know whether those things are making our kids safer. But what we do know is if a child doesn't gain access to a firearm in the first place, they're not able to bring it to school. So you can go to the next slide. So many of you may have actually had Be Smart presentations at your local League of Women Voters meetings. If you haven't yet, I encourage you to reach out. I'll have my email at the end, but reach out, because these presentations, the thing that makes them brilliant is they truly take the politics out of responsible gun ownership, because they start from a place where they assume that you own a firearm. So right there, we already are starting in a place where there's a lot of common ground. So the Be Smart presentation, it's about 18 minutes long, and it's this framework designed to help people talk about guns, talk about, you know, how do you ask another parent before a play date whether or not they own guns, and if so, are they stored responsibly? And we are going around doing this work in PTOs, in pediatricians' offices, in schools, police departments, and with you guys as well. We've seen really great effects from these presentations. Specifically now, we have a lot of local schools that are talking in consistent form about safe gun storage directly to parents. In my town, actually now, you are required to sign a safe gun storage pledge before you can enter your kids into our school district, which is pretty incredible. So yeah, that's something it's a really good program, and I encourage you guys all to have those come to your meetings. I would be crazy if I didn't talk about the huge victory that we just had legislatively in Illinois. I don't know how familiar you are with this, but the Protect Illinois Communities Act was just passed, a month and a week ago. And it certainly was not all Moms Demand Action. This was many, many different gun violence prevention groups and groups like League of Women Voters doing the hard work to get the right candidates into office and advocate for this bill. So basically, it bans the sale and manufacturing of assault weapons, high capacity magazines, and switches and clips. It extends the duration of a firearms restraining order from 6 to 12 months, which is really important because we know 6 months is frequently not enough time for difficult situations to resolve themselves. So that extra 6 months is really important. The bill also addresses illegal gun trafficking. We know that 50% or more of the guns that are used in crimes in Illinois are actually being brought in from states around us that have much weaker gun laws. And lastly, but very importantly, the bill requires serialization and registration for assault weapons if you owned them prior to the passage of this bill, which is pretty groundbreaking. That is, a registration for firearm ownership is something NRA has definitely does not want. So you can go to the next slide. It's really important to note that the piece of legislation that just passed, everybody talks about it as being groundbreaking and comprehensive. And yes, it was, but assault weapons and mass shootings are a small part of the gun violence problem in Illinois. Mass shootings are actually only about 1% of all gun deaths. So the strategic priorities that we have here for the next legislative session are supposed to be more broad in their scope. And the reason I feel pretty good about this is because our organization has some serious street credit right now with lawmakers. I think the lawmakers have really realized that the calculus has changed in their electability if they use gun sense policy as a core to who they are as candidates and who they are as lawmakers, which is really exciting for us. I'm sure that you've read in the media that the NRA's membership is declining rapidly, and Moms Demand Action has now well over 10 million members. So we're definitely going in opposite directions there. And for the first time ever, we have people now in the Illinois state legislature calling us, asking for what they think what we think they should be legislating on, which is obviously a very new position for us to be in. So we're looking to strengthen safe gun storage laws in Illinois. We're looking to pierce the idea of not being able to sue the gun industry. So currently there's this JR-15, it's a junior assault weapon that's being marketed to kids and it's being manufactured in Illinois. That's something we would like to be able to sue over, the marketing practices, marketing to children. Very importantly, we would like to renew funding for community violence interruption programs. This is something that is critical to helping Chicago gun violence. We would also love to address unsolved crimes, which right now the clearance rate for murders is under 50% in Chicago. And we know that guns that are used in murders are then used again and again and again, up to, countless times. So if we can clear those out and get those people addressed, that's extremely important. So there's many other things that we're prioritizing, but those are the key ones. And I feel pretty good about this next legislative session. A lot of these bills actually already exist and are being introduced as we speak. So we'll be reaching out for advocacy on behalf of those bills really soon. So yeah, so I mean, I don't need to go through this in detail, but I hope that you guys realize Moms Demand Action is more than just legislation. We are also working to partner across the state with other organizations. I didn't talk about it very much in this presentation or at all, but we also work quite a lot on supporting lifting up the voices of survivors. That's an important component of Moms Demand Action. And I think one of the exciting things that has been growing within the organization is the Demand a Seat program. If any of your members are interested in running for office, they might consider joining Moms Demand Action and looking into this program, because it's training for how to run for office or how to run someone else's campaign. It's been really successful. A lot of candidates that have gone through this program won their elections in 2021, which is great, because the whole point of getting people into office is so that they can then introduce and support and then pass gun violence prevention legislation that will save lives. So on the next slide, there's a QR code that you guys can scan. Specifically, what this will take you to is a document that we used locally in my chapter. But it has scripts in it that will allow you to initiate emails to a whole host of different groups, police, schools, village leaders, to talk about safe gun storage. We could wait for laws to address this, but we don't actually have to. This is something that if we get into the conversation every day, it will save lives. So the other thing is at the top, you can text READY to 64433. I'd be crazy if I didn't tell you guys to go do that, because then you can key into a lot of the Moms Demand Action events and come to our meetings, and we can continue this partnership, because it is a great one. So anyway, I'll stick around for all the questions, but I would love to turn it over now to Sara Knizhnik to take it from here.
Yeah, Lauren, thank you.
Yeah.
Let me give Sarah a quick introduction. She is the organizer of the Illinois Gun Violence Prevention Coalition, and she's the director of the Community Engagement for Newtown Action Alliance, a national gun violence prevention group founded in the wake of Sandy Hook. So Sarah is incredibly active for years in the gun violence area. So Sarah, take it away.
Thank you very much. And thank you to every single one of you who have joined us. And thank you, Lauren. I'm really, really happy to be here. Just a slight correction. I did hold the two roles that Jim just described. I'll give you a little bit more context so that my main thing is I don't want you to walk away today thinking, my only role is with the Gun Violence Prevention Initiative in Lake County. That is what I'm going to spend most of my time talking about, but I would like to tie the GVPI to everything Lauren just talked about. But first, I'll give you some context and explain how I ended up here and how I ended up chair of the GVPI. In 2015, I started the first Moms Demand Action group in the northern suburbs. In 2017, I left behind a 17-year teaching career to take my first full-time position as a gun violence prevention advocate. From 2017 to 2019, I worked with actually gun advocates all across the state, some of whom are in this meeting with us right now, to help pass gun safety laws in Springfield, including the Gun Dealer Licensing Act, the Firearm Restraining Order, and the 72-hour waiting
I can
period.
take this one.
Who's this there?
It was on the dresser.
I then went on from 2020 to 2022 to do the same thing at the federal level. That's when I worked for Newtown Action Alliance, and I worked to get support for various initiatives, primarily Ethan's Law, which is a safe storage law, which again, that was work that we did at the federal level. We got all the support needed for that in the House, and characteristics, specific items from that bill made its way into the Bipartisan Safer Communities Act, which President Biden signed in June, the first gun safety bill to become law at the federal level in 30 years. The other major effort that I pursued as part of a member of the Newtown Action Alliance staff was to get federal funding for community violence interruption programs. And that's what brings me to the GVPI. Throughout that entire period from 2016 until last year at about this time, when we announced the launch of the Gun Violence Prevention Initiative. So beginning in 2016, I began lobbying for this program in the Lake County State's Attorney's Office. And it's very much key that this Gun Violence Prevention Initiative is in a prosecutor's office. And the reason for that is because if we wish to end the gun violence epidemic in America, in Illinois, in Lake County, in our communities, then we must not only work to do things like pass an assault weapons ban, we must also prioritize ending gun violence that happens every day in our underserved communities. And that means more than just addressing the acute problem of the violence, but also addressing its root causes. And its primary root cause is inequities in the criminal justice system. So I wanted this program in my state's attorney's office because through that program, as you'll see in a minute, we are both working to get professional violence interruption in Lake County's underserved communities, while at the same time expanding alternatives to arrest and incarceration. So the reason I wanted to kind of give you that intro is because if you kind of think about and remember everything that Lauren just shared with us, what is so important to know is that the assault weapons ban must be only the beginning of the change that we demand in Illinois in terms of our gun safety laws, because it's really all of the other initiatives taken, it's all of these regulations taken together that will end up resulting in real change, because of the point Lauren very articulately made about how only about 1% of all gun violence is committed with an assault weapon. So in recognition of that fact, this is what we are doing in the Lake County State's Attorney's Office in order to address on a much more systemic, widespread and permanent basis the gun violence crisis. So the Lake County State's Attorney is Eric Reinhardt. He is, can you go back one more real quick? Sorry. Eric Reinhardt is the Lake County State's Attorney, and from the moment he took office, he and I set out to design this program, and I'm very fortunate to have been named the chair of this program. Next slide, please. The Gun Violence Prevention Initiative is designed to address the acute problem of everyday gun violence and its primary root cause, inequities in the criminal justice system. We're doing that in three main ways: by creating the first professional community violence interruption program in Lake County's underserved communities. You may have heard these kinds of programs in the past referred to as street outreach or violence interruption. So these are programs that are staffed normally by people who are formerly gang affiliated and or formerly incarcerated. And the reason for that is because they are the only people qualified to do this work. The purpose of this type of program is to get people with credibility in these underserved communities. And that credibility comes from having similar lived experiences to the people in these underserved communities who are most at risk or in risk of committing or being a victim of gun violence. So the programs, the organizations that have been doing this work in Cook County have had a great deal of private funding for years. I was very fortunate years ago to be able to become familiar with the people heading up these types of programs in Cook County. And I realized that in Lake County, we don't have that sort of private philanthropic base of funding that the Cook County programs do. So my idea was to get an Office of Violence Prevention, again, in the state's attorney's office. The state's attorney would be able to secure public funding for community violence interruption in Lake County. And that is exactly what we did as of March of 2022. I will share more details about what we're going to do with that money, that public funding, in a few minutes. But the other two main ways that we are addressing both the acute problem of gun violence and its primary root cause is we're creating alternatives to arrest and incarceration for nonviolent offenses. And we're building a robust network of community-based organizations, faith communities, educational institutions, public health professionals, and law enforcement to provide wraparound services and trauma-informed care. And I'd just like to make sure everyone is aware, we are absolutely at the forefront of this. In Lake County, we're only the third prosecutor's office in the country to house this type of initiative. Next slide, please. So this just goes into a little bit more detail of what I talked about before. I'm going to describe a bit more what the Community Violence Interruption Program is about. It's an aggressive, evidence-based technique that relies upon intense and sustained engagement with at-risk individuals. And as I said, in addition to that, we're implementing alternatives to arrest and incarceration. That's what we mean by criminal justice reforms. And we're creating a network of community support. So it's a hybrid. We're building a community-based hybrid between government agencies, CBOs, and for-profit entities to make everyone in Lake County safer. Next slide, please. So this is sort of a visual representation of what we're building out. Within days, by Monday, I expect, we will be adding a fifth puzzle piece. I call this our puzzle piece graphic, but it sort of illustrates for you the network that we're intending to build. I shouldn't say are intending to build, the process is already underway. So the Gun Violence Prevention Initiative, we got our first $1 million approximately 1 year ago when the Lake County Board awarded funds from the American Rescue Plan Act so that we could begin this process. Our first priority, because we're well aware that the most urgent problem within the gun violence crisis is ending the everyday gun violence that happens in our underserved communities. So our first $1 million is focused on building out that CVI program that I've already talked about. What we're also going to do is, and we already have begun the process, is build a network of organizations in Lake County that are providing mental health counseling, substance abuse counseling, youth mentoring, all those types of wraparound services that really help people rebuild their lives and help people have alternatives to being engaged in activities that can lead either to violence or criminal behavior. And this is what we're doing here in the restorative justice piece. This is what we're doing that no other Office of Violence Prevention in the country is doing, because most of them are in municipal administrative offices, such as mayor's offices. But because ours is in a prosecutor's office, we're combining all of these other efforts in terms of providing wraparound services and violence intervention with creating deflection and diversion programs. So I'll explain a little bit more what those two terms mean, but they're all based on principles of restorative justice. So I'll go into more detail in a minute. One last piece. This within days, hopefully by Monday, we will have added another puzzle piece to this graphic, and that will include the Office of the Regional Superintendent of Schools in Lake County. And that's extremely important because that's where we're going to address the school to prison pipeline. Next slide, please. So you may be wondering, why will this integrated model make all of Lake County residents safer? That's a pretty bold claim that I made a couple of slides ago. And the main thing, the easiest way I know of to explain it is what happened in Highland Park on July 4th is a direct result of our failure to address everyday gun violence in underserved communities and its root causes. And this is how they are connected. Next slide, please. So in the 7 years that I've been doing this work professionally, full-time, pretty much around the clock, one of the things that has become very, very clear to me is that gun violence, no matter if you live in a community of privilege, it is not somebody else's problem, it's everybody's problem. So we must all work together to end it. And I'd like to make the connection for you just in case no one ever has. What you need to know is that those of us who are in favor of gun violence prevention policies and are members of the gun violence prevention movement, our opposition is not gun owners. The NRA, the gun lobby, wants us to believe that our opponents are everyone who owns guns. That's not true. The vast majority of the gun owners that I know and work closely with, and they count in the hundreds, are completely in agreement with me in terms of wanting universal background checks, safe storage laws, and so on. Our opponent in this fight is the gun industry, the gun lobby, and the politicians at all three levels of government who do their bidding. And I would like to make a very bold claim. It's not a claim, it's a fact. And I can refer you to evidence research. I got lots of books that have been written on the subject, but it doesn't get talked about enough. And I really urge everyone listening to start talking to your neighbors and friends and helping them understand that that the gun lobby wants gun violence to be high everywhere, but especially in Black and Brown communities. The reason is because then they are able to use racist marketing strategies to promote and sell their products to people everywhere. So nothing sells guns as well as fear and racism. And I want you to think about, please, the fact that one of the most popular assault style rifles on the market is called the Urban Super Sniper. It is not a coincidence that that rifle is named the Urban Super Sniper. And the people who are most open to getting that marketing message, they know exactly what that means, right? And so when gun violence is high in Black and Brown communities, your neighbors, and if you are fortunate to live in a community of privilege, they're more likely to go out and buy a gun or 20 because they're afraid, because the gun industry is telling them to be afraid. So now we are in a situation where there are many, many more guns on inventory in schools, guns that are accessible to kids in people's homes, available to be stolen, and so on. And the key thing to remember is that that is by design. The industry wants it that way because they want you to be afraid. Next slide. Here is some information to sort of back up the previous slide. I'm directing you here to one book written by Ryan Busey, who is a former executive from Kimber Arms. He worked there for 25 years. And over the course of his career, sold something like $25 million worth of guns. And this is a direct quote from him. The gun industry's modern marketing effort did not just arm the shooters that we are seeing today, but in a very real sense, it created them. So I direct you both to his book, but also to this article, which supports the claim that I made on the previous slide. I've also included here a really important article that it's not just an article. This is not an op-ed piece. There's data here, evidence, really laying out the financial toll that the gun violence crisis has on everyone in America, on communities, how it affects your tax bill. And everyone needs to start realizing, what I would like most is for people to start realizing that our costs are soaring in terms of public health and taxes and so on. And the reason for that is we've allowed it to be that way. We're paying more and more and more so that the gun industry can just keep reaping bigger and bigger profits. So that's a really important thing to keep in mind. And again, next slide, I will just repeat the claim. If, actually, could you go back 2 slides? So it's not enough to just address the acute problem of gun violence, whether it's everyday gun violence in underserved communities or address the acute problem by passing an assault weapons ban. We must also address the root causes of gun violence in underserved communities. And one of the ways we do that is through reforming the criminal justice system, because inequities in that system are the primary root cause of gun violence in our underserved communities, which drives all of the other violence. Because of the freedom we've given the gun industry to use that violence to sell guns to your neighbors. Okay, can you please skip ahead 2 slides? Thank you. So we're doing exactly that. We're not just talking about this in Lake County, we're actually walking the talk. And we're doing that through the Gun Violence Prevention Initiative. We have launched Lake County's first community violence interruption program. So that's going to be street outreach. That's what I mentioned earlier. It is under the leadership of the Waukegan, it is under the leadership of Waukegan Township. And it's primarily focused in the short run on Waukegan, North Chicago, and Zion. However, we will be expanding that, our impact area beyond that particular 3-city area in the years to come. We are also continuing to expand the alternative sentencing programs for nonviolent offenses in the Lake County State's Attorney's Office, and we are building out this community education program. So that, again, in the short run, we're holding community education and public awareness events in order to make that connection that I made for you in a few slides ago about how when gun violence is high in Black and Brown communities, it leads to gun violence everywhere. But over time, we will be expanding our community education and public awareness events to address all forms of gun violence in all Lake County communities. Next slide, please. So I won't read every word here, but I'll just kind of give you the highlights. Street outreach, community violence interruption. These are programs that work in partnership with law enforcement. So yes, this is people on staff who are formerly incarcerated, formerly gang affiliated, and they work in partnership with law enforcement to help identify hotspots in the community. And that's where the violence interrupters, those formerly incarcerated or gang affiliated who are on staff, they are working proactively, proactively to stop the violence before it happens. And so it's a real partnership between law enforcement and these violence prevention professionals. As I said, we are also going to support, help get funding to community-based organizations in Lake County that are providing wraparound services. We are already working with the newly constituted Juvenile Justice Council in the state's attorney's office to address the school to prison pipeline. And finally, with Dr. Halleh Akbarnia and other folks in her professional network, we are partnering with Condell's Level 1 Trauma Center and Advocate Aurora Health's Trauma Recovery Center in Gurnee to train violence interrupters and other service providers in trauma-informed care. Next slide, please. We are increasing treatment as well for first-time offenders who take responsibility for crimes through the Domestic Violence Prevention Program. This is another attempt to expand deflection and diversion programs, and I've defined deflection and diversion there at the bottom of this slide. We're expanding the number of attorneys in the Rehabilitative Services Division in order to expand admissions into these diversion and specialty court programs. And we're addressing the problem of underrepresentation of defendants of color in our felony diversion program and expanding the number of participants who fit that description. Next slide. We are also continuing to add data to the state's attorney's office dashboard. If we're able to share slides with the people listening, this is an embedded link and you can go and look at the data yourself. We're developing new expedited diversion programs for first-time non-violent, non-DUI misdemeanors, and we're increasing law enforcement training for the Living Room Wellness Center. The Living Room Wellness Center, again, there's an embedded link there. The Living Room Wellness Center is a place where law enforcement can take people who are in crisis, but don't need to be inducted, I guess, into the criminal justice system. So it's an alternative to get people help rather than just putting them in jail. and then having them enter the court system. And we're also changing the state's attorney's office prior policy under its former leadership of automatically objecting to expungement and sealing requests for certain offenses. So expungement is clearing your record once you've served your time. And obviously that's not possible for every offense, but for many it is. And that helps people after incarceration get jobs. Again, that's the kind of thing that strengthens our underserved communities. So again, that's another way of addressing the root cause. So next slide, I think we might be at the end. Yeah, so this is just more examples of what I've talked about already, and I know I've gone over a bit. So let's go to the next slide. Yes, so that sort of pretty much wraps it up. What I hope you will come away with is the understanding that there are already efforts underway, either in your own county, for those of you who live in Lake County, or not too far away, where we are actually doing real substantive things on the ground every day to both address the acute problem of gun violence, but also its primary root cause. And it is our dream to see offices of violence prevention in every state's attorney's office in Illinois. Those are the kinds of things that will lead to real permanent systemic change. And that's really what future generations need, not Band-Aids. They need solutions like this one, the GVPI, that will really address the underlying causes. So I'd love to answer any questions if anybody has them when the time is right. And everybody is welcome to reach out to me with questions and so on. Thank you.
Thank you, Sarah. We'll move on to Halleh. Let me give you a quick introduction. She's an emergency medicine physician who has been at level 1 trauma centers for almost 20 years. She's working with gun violence victims and having been personally affected by gun violence herself. She's become a strong advocate for GVP, gun violence prevention, at both the local level and as well as national. So Halleh, it's all yours.
Okay, thank you very much, Jim, for having us here. And I'm going to try to make it a little short because I know a lot of people have a lot of questions at the end, and we definitely want to get to that. And Sarah and Lauren did such a great job of talking about a lot of the root causes that exist with gun violence and why it exists. So I'm going to get a little personal for a second. For me, it's very important that people understand that it was a big deal for a while. Tamara O'Neill was an emergency medicine physician who was shot and killed outside of her place of work in 2018. And it was just around the time when the NRA had come up with this tweet out there that had said that someone should tell self-important anti-gun doctors to stay in their lane. And that was right around the time that she was shot, and it sparked an entire movement in the world of people in medicine to basically say this is our lane. Joe Saccharin is a trauma surgeon out of Johns Hopkins, and he basically started a movement called This Is Our Lane, and basically saying that, you know, we are the ones who deal with these victims every single day. We talk to their families, even if you're not a physician that's directly taking care of patients. You know, this is a very, we're physicians, and medicine and healing is part of what we do. So this was something that became very big around 2018 with involvement of physicians. So absolutely, we belong here. For me, it also is very personal, and in practice as an emergency medicine physician, this is often what I see. I'll spare you the pictures of what we actually see with the patients, but this is often the aftermath of taking care of a gunshot victim. It's not pretty. It's very emotional. The entire team is down there, and it takes the toll on everyone because these are often young people who are oftentimes in the wrong place, or people who happen to have something like, more often than not, someone had a gun that was unsecured. And as Lauren mentioned, suicides are one of the biggest things with gun violence, although we actually don't see a lot of suicide victims because unfortunately they're very successful in that when they use guns. But for me, it also is personal because it's something that I've experienced when I was in 7th grade in St. Louis. One of my great friends' brother brought a gun to school, shot several people in the classroom next to mine. And this is a person who had been in their home. So I was in that house with these unsecured guns. This is before social media, so parents really didn't know much except what they heard on the news that multiple people had died at Parkway South Junior. And that was my first experience with gun violence, although I don't think we even thought anybody else went through it because of the lack of news that was out there. I also was walking out of my emergency department one night in Community First in Portage Park. And literally at the time that I walked out, a gentleman drove by and started shooting at the side that I was on. And I ran for my life to my car, and every bullet that I heard, I thought was the one that was going to kill me. And that fear and that primal feeling of like, just, that fight or flight is a real thing, sitting in my car and not even realizing, like, where is this person and are they going to get me? But they definitely ended up riddling our emergency department with bullets. And if a nurse or patient had been walking by there, they definitely would have been shot. So we did get lucky there. I also believe strongly that gun violence is a public health issue. And I think with all of my interest in this, I finally decided, well, I might as well go back to school again. And so I'm in the second year of a 3-year program, getting my master's in public health, so I can put a lot of the language to the work I'm already doing. And in the process of all of this, I've met a lot of people who are doing the work. And I've been able to kind of pull out of the place where I was before, where I was just doing lectures for moms demand groups or, trying to educate. But now this is kind of how I've even met Sara and Lauren, is that now at least I know my voice can be a little bit more important when it's time to give testimony or talk about what we see or my own experience as a gun violence survivor. We did talk a lot about some of the statistics, so I'm not going to go through too much of this, but just so that we're aware, every day over 300 people are shot and over 100 people die, and that these statistics are slightly even a couple of years older, and they're even more so right now. And every year we're just seeing these climb. We have seen a very sad trend where motor vehicle crashes were the #1 cause of death among children and adolescents. And in around 2019, 2020, that intersection went the other way. Gun violence shot up and motor vehicle crashes are continuing to go down. Even the preliminary data from 2021 and 2022 show that MVCs are going down, where firearm injuries are still continuing to head on up. This is really disturbing because obviously neither one of these are good, but you can see that trend of downward trend with the motor vehicle crashes. There's a reason for it. We instituted seatbelts and made cars safer and airbags, and we did all these things and made it so that we didn't have to take cars away from people. We just had to make them safer, and that is the entire concept behind firearms: make it safer. Homicides, you can see firearm is the #1 reason, and it's just the trajectory upward is just incredibly sad to see every year how homicides, firearms are the #1 cause by far of homicides, and suicides as well, and especially successful suicides. We don't see suicides that often in the emergency department because they're so successful, although I can tell you that at one time I did have a patient who had overdosed initially, called their family, and then by the time the family got there, he was still alive. He shot himself, and by the time he made it to us, there was nothing we could do. But we do get to save people who have overdosed, and oftentimes with other causes of suicide attempts. And then begins the hard road of taking them through therapy and getting them back to a place where hopefully that won't happen again. But at least we have a chance to help them. Putting a gun in those homes and in those hands is they will not survive that. So that's something to think about. In the last 2 years, putting both what Lauren and Sarah put together, racial injustice is definitely something that we see with our gun victims. Homicide rates and suicide rates both have gone up, and the largest disparity within a decade has been seen in both the Black population and the Hispanic population in this arena, which tells you a lot also about how COVID affected our underserved areas. We have a lot of work to do in public health, so I'm taking notes. More of the similar, just the change in rate of homicides between 2019 and 2021 was driven by guns. The rate went up by about 45% with guns and about 6% by non-guns, and similar type statistics with suicides. Just very fascinating to think about. So to kind of finish this off, just a few things. Everybody always is like, well, what can we be doing, or what should our laws be doing? I think Lauren touched on this a lot about some of the things that are needed in our current laws, both federally and nationally. I mean, both federally and locally. So I'm not going to go through all of this, but it's important to really, I'll actually go to the next slide where we talk about a lot of what you can do just yourselves at an individual level. For me, like I said, initially I did things kind of on my own and realized that I think I was just making myself feel better, that I was out there educating, and I'm sure to a certain extent it was helping, but really I think what helped me and really where I felt the most effective is once I started joining some of the groups, of which I now I've got my feet in a lot of different places, but places like Moms Demand and March for Our Lives definitely have given me the ability to have a platform, and Doctors for America have been able to give me a platform to be able to speak on behalf of a medical professional. As someone who takes care of gunshot victims, all my life I've been at level 1 trauma centers, and to be able to speak to legislators and talk to them about really what it means. I even had the opportunity to sit on the stage with President Biden during the national vigil and tell my story there as well too. So I've had a lot of great opportunities to be able to vocalize that. And I can tell you it wasn't my forte. I'm not a big fan of that, but I think I understand that it's important and needed. And it's something that I think more physicians can be doing, and then working hand in hand with grassroots organizations to really just do the boots on the ground type work that's needed. Here are some links that you can, we'll hopefully be able to give to you embedded or separate after this, so that you can actually go and look for yourselves some information about where to get resources and information and education as well. So here's some references in my contact. And I think that's about it. I'm going to go ahead and stop sharing my screen, Jim. Is that okay?
Yeah, sure. Yeah, I've just got a quick one that I want to, I'm going to bring it up. Let me do a quick screen share here. We'll tell you what. Let's just go to questions while I try to find that last slide. I've got a couple of questions that I want to get the questioning started with, and the first one is for Lauren, and we see this quite often. People, when there's a mass shooting, people get they want to know what they can do. So there's a lot of excitement, and then within a couple of weeks it fades away. So Lauren, what could we do to keep people motivated between shootings when the subject is so hard? Any comments?
Yeah, I mean, it's a good question, and it's something that we are grappling with pretty much all the time at Moms Demand Action, because our engagement does just spike off so quickly, even like 72 hours after a school shooting or a mass shooting. And I think, I would answer that by saying, like, we really have to create a culture that revolves around the idea of honoring through action. And one of the things that our founder, Shannon Watts, says all the time is that like the daily unsexy work, like the going to a school board meeting or talking to your neighbor about safe gun storage, like that really hyper local work is sometimes the stuff that is the most impactful. And so we try really hard to get people to understand that just continuing the conversation and using the knowledge that we give them in meetings and presentations like this on an ongoing basis is really important, but also just like making your voice heard when you go to see your pediatrician. I recently had a member like a year ago who said, why aren't we talking to pediatricians? Why don't we actually start a campaign where we have all of our pediatricians talk to each family about safe gun storage when they do their well checkup visits? And so it was such a good idea that when our whole group scheduled their next appointment, we had everybody go in and mention that to their pediatricians. And then suddenly we had big pediatrust like pediatricians offices reaching out for Be Smart materials. And they did in fact make it one of like the 10 questions that they made a part of the well checkup visits. And I think like seeing that tangible results on a hyper local level is super satisfying for people. So instead of thinking like, oh, we have to pass big laws, and instead we can impact, our town of 12,000 or whatever, 50,000, whatever it is. I think that's a really good way to keep people engaged. Just like it's an everyday cultural mindset that we try to instill in our members. So that would be my thought. It is emotionally taxing, but if you feel like every time there's a school shooting, you need to go pass a law, that's a lot harder than, okay, I've been doing something little every single day, so I know I'm making a difference, right? So.
Yeah. Thank you, Laura. One thing that crossed my mind during your presentation was the amount of money we're spending to fortify schools, when one thing that we need to do is just get people to secure their guns.
Yeah, like a gun lock on Amazon is about $6, and a safe, you could buy a biometric safe on Amazon now for under $50.
Yeah.
It's so simple.
It is. And talk to your school boards about safe gun storage. Talk to them about getting a Be Smart presentation done for the school board, for the teachers, for the administrators. Contact your local moms group. It's a great presentation. Like you said, it's 20 minutes.
Yep. And it can be done alongside information about firearms restraining orders too. So we can just sort of double the impact. I encourage you to have a police officer come in and talk alongside a mom from Moms Demand Action about all of the above.
Yeah, thank you, Lauren. Quick question, Sarah, you mentioned your Honor with Action group. Do you want to talk a little bit more about that?
Oh, yes, thank you. Appreciate that, John. I want to just give everybody an example for what Lauren was just talking about. I'll talk about Honor with Action in a moment. But now that I've been in this movement for so many years, the advantage to that, and is exhausting and tiring to stay in the fight for so long. But what I'm also getting from this experience is I'm getting really good now at recognizing progress that we're making that didn't used to be immediately obvious to me. And I'd like to share an example. Earlier this week, Lake County State's Attorney Eric Reinhart announced the arraignment of the shooter at Highland Park. His father has now been arraigned and he is being held. We're going to attempt to hold him legally responsible for allowing his son to get the assault weapon that he used to kill 7 people in Highland Park. What happened a year and a half ago, the state's attorney in Oxford, Michigan, took a very unusual step and charged the parents of the shooter in that school shooting. And then if you fast forward to the MSU shooting, which happened just less than a week ago, I believe, I noticed something that I have never seen before in all my years in this work. Within 24 hours of the shooting at MSU, the shooter's father gave an interview in which he proactively tried to defend himself from legal prosecution. He claimed in an interview that he tried to get his son to give up his gun. And I would bet my house that the reason he did that is because he has received legal counsel advising him to do that. And that is huge. That is the very cultural change that Lauren was referring to, because what it means is people are going to notice that, right? And they're going to think twice next time when they leave their gun unsecured in their home. And if they feel like maybe there's someone in their home who might be able to get access to that gun, but shouldn't have that access. So those are the kinds of sort of victories that are not obvious, but once you've been in the movement for a while, you learn to see them and it helps you continue moving forward. So that is my segue into answering Jim's question. I do run an organization called Honor with Action Illinois. We just meet only virtually every other Friday. And the purpose of the organization, we're a little bit different than most advocacy groups in the sense that we're really about educating people, advocates mainly, people who lead advocacy groups, but also individual advocates or members of other advocacy groups who really want to go deep on understanding the gun violence crisis and how it all works and fits together. So it's really for people who want to really commit themselves to this issue. That doesn't mean you have to spend hours, if you choose to join us, it's really a commitment of only, 1 hour every other Friday, but it's a way to consistently stay up to date and knowledgeable about the issue and where the different ways that you can get involved at both the local, state, and national levels. So my email address is in the chat. I'd love to have anybody who's interested join us. And there are at least 10 people in this group who've already joined, so you'll be in company with friends. So thank you.
Thank you, Sarah.
Excuse me, Jim, we do have a question, but on the participants list.
Yeah, well, let me handle it. Okay.
Okay.
I have a question for Halleh. What is an aspect of the gun violence that you see in the ER that you want to make sure people who attended this presentation really understand?
Yeah, thank you, Jim. Obviously, I touched on some of it, just the types of injuries that we see. I mean, the majority of what we see is going to be everyday gun violence that happens in the communities. That is the absolute root of a lot of gun violence that's out there. A lot of accidental shootings, guns being discharged when people are cleaning them. Safe storage is a huge, huge thing that I think if we could tackle that problem, we would be in a really good place. And also just the emotional strain that it brings on to every single person who takes care of these individuals, from the brand new nurses out of nursing school who have never seen something like this, to the chaplain, to the social work. And we're fortunate in our emergency department to have a trauma recovery center that, and that's one of the ways that I met Sara, is at a rally before Highland Park. It was at Highland Park when we talked about how absolutely we need to connect what we are doing in the hospital to what she's just brought into Lake County. It just makes sense. And so I think the more people understand that what happens in the hospital does translate back out into the community, and that so many of what we see is injuries that people don't always hear about, because not everybody wants to talk about the fact that their gun accidentally shot off and hit their groin. But these are injuries that they have to live with, and it's just important that everybody just understands that too.
Thank you, Halleh. Yeah, and one thing I want to point out too is all three of you, different organizations, but we're a community. We all work together. And I just encourage everybody on this call, join an organization. It doesn't matter which one, but get involved with the community, the gun violence community. So we got a question from Mary Holbein. Mary, go ahead and unmute yourself.
Okay, Sarah mentioned restorative justice, and that's something I'm very interested in and very much in favor of. Especially, why in the world would you send a nonviolent drug offender to prison instead of rehab? But whenever you have any kind of a progressive thing like this, you're going to get people who bellyache about the cost to the taxpayers. So my question is there any data comparing the cost of restorative justice programs to the cost of imprisonment?
So I assume, yeah, may I respond?
Yeah, go ahead. No, I was just going to say, Sarah, that's for you.
Oh, thank you, Mary. Thank you for that question. I cannot point you to specific data, but I know exactly who to ask to find that data. So if you would like to email me, I will find it for you. I know for sure where you can find data that really lays out the cost of gun violence. I just don't know of a study that compares them side by side, the cost of gun violence and the cost of restorative justice type programs. But if it exists, I know exactly who can help us find it. Okay.
Okay.
Yeah, the cost of society is just incredible. So Howard Miller, go ahead. You got a question. Unmute yourself, sir.
Hi, my name is Howard Miller, and by the way, I'm a member of Brady United Against Gun Violence, as well as the Sandy Hook Promise. But my question is, in all the statistics that were shown by the three of you, there's one major issue left out, and that's veterans. Veterans are suffering from PTSD from Vietnam to the Gulf Wars, etc. Don't you think they're a group that we should be concentrating on and including in the people that need help? Thank you.
Thank you, Howard.
May
Jen?
I respond quickly?
Sure, Sarah, go ahead.
Hi. I'm really glad that you raised that. Yes, absolutely. I 100% agree. There are efforts to do that. We're swimming against the tide on that. And I'll just give you an example of what I mean. The U.S. Department of Veterans Affairs, in my former role, the Newtown Action Alliance, we reached out to them in order to ask for their support for Ethan's Law. So even though that law is focused on keeping guns out of the hands of children, who of course are not veterans, we still wanted their support because it is a straightforward safe storage law and lays the groundwork for other types of safe storage laws. But it also will make anyone in a household safer who hopefully, right, it'll lead to behavior change, I suppose, that would keep guns locked up from people who shouldn't have them. And by shouldn't have them, it doesn't just mean people who might use them to commit a crime. It means people who are not mentally in a state of mind where they should do that, or where they should have access to a gun. And we're swimming against the tide in this effort, though. And what we found out when we talked to the head of the U.S. Department of Veterans Affairs is that they're working very, very closely with the National Shooting Sports Foundation in order to run Project Child Safe. Well, no, that's another department in the federal government, Project Child Safe. But the Department of Veterans Affairs has a similar program that they're running with the National Shooting Sports Foundation. And it's important to understand the National Shooting Sports Foundation has actually spent many millions of dollars more than the NRA in the years since Sandy Hook in order to defeat gun safety legislation at all three levels of government. I was just, I happen to be a Lake County board member, and I was just at the National Conference for County Board Members in DC last week, and I had the opportunity to talk to representatives from the Bureau of Alcohol, Tobacco, and Firearms, and really let them know how it's completely wrong for them to be partnering with an organization, because the ATF and the Veterans Affairs both partner with NSSF. It is completely wrong for them to be partnering for an organization that is fighting back against those of us in the gun violence prevention movement at every level as hard as they can. And they are far more well-resourced than the gun violence prevention movement is. So in other words, Howard, I really look forward to talking with you more about this and anyone else who's particularly focused on the issue of veteran suicide by firearm. But just know it's a different battle, right? because we see those kinds of challenges, right? And so it's a David and Goliath battle, even more so than all the other sort of sub battles within our movement.
Can I just
Thank
add
you
a quick thing in there?
Yeah, go ahead, Lauren, do you have something?
Yeah, sometimes I think that when people ask questions, they maybe have something in their head that is a brilliant idea just waiting to come out. So Howard, if you have anything that you feel personally needs to be done, just reach out to me. I put my name in the chat and my email in the chat because good ideas come from everywhere. So
Thank you,
Also,
Lauren.
I want to add to that.
I'm sure you have a wealth of knowledge there.
I wanted to add to that too. You say that you're connected with Brady. I know that I spoke with Chris Brown, who's the president, who's the, I guess, president of Brady. And when I was in DC at the National Vigil, Brady did a lot with the survivor conference that was there. And they had an entire arm dedicated to veterans as well. So that might be something that's a majority with Brady. They do have a strong, at least it seemed like they had a big component that was dedicated to veterans. I don't know if you're involved with that or not. And maybe that's why you're with Brady.
Thank you, Halleh. We have one more quick question. Jan, go ahead, unmute yourself. Go ahead, you're unmuted. Go ahead, ask your question.
Thank you. Can you hear me?
Yes.
Okay. Social media, I haven't heard it mentioned, and teenagers insult each other every day. Lots of times it's just verbal, but many times it leads to physical altercations. And I've noticed in these violence interruption groups, they go after teens who are so-called at risk. How about the everyday teens that say things like, you insulted my girlfriend on social media, I'm going to meet you tomorrow after school, and they come with a gun? What can be done about that? Can we monitor this somehow? Is there anything that can be done while the threats are unfolding? Because, you know, meeting each other to take care of these insults has been going on since time immemorial. I just wondered if they've escalated because of social media, if there's somewhere to meet that interruption in between. What can be done about that?
I mean, I would take that really quickly, and then I'll jump over to you, Sarah. Just within our organization, we've been working with the villages and the schools to figure out where that gap is in the middle, because social media doesn't happen on school grounds. And so there are some villages and some towns throughout the state that are developing a task force to address exactly what you're talking about right now. You know, we're like a decade behind on addressing this, though, because it has proliferated so quickly, and I think school administrators are playing catch up. But it's a great question, and there are some programs that are being put into place. So go ahead, Sarah. Sorry.
Oh, that's okay. I was just gonna say, it does have a lot to do with who your local law enforcement officers are and how committed they are to being proactive in that way, how resourced they are as well. I don't want to imply that law enforcement officers in some communities are just shirking their responsibilities. In some cases, they don't have the funds for that. But I know the Lake County Sheriff's Attorney's Office, the Lake County Sheriff's Office is very intentional about things like that. So that is something that just as a resident, that's a point of pressure that you could apply. You could ask your elected, your sheriff's office. You could find out whether or not they're being proactive by sort of monitoring social media for those kinds of things, and then make the same asks of your local police officers. I expect the answer in many cases will be no, we're not actively monitoring that, but speak up and ask for it. And then the other thing, and this took me a long time, I was 5 years into this work before somebody really pointed this out to me. Mayors and state's attorneys, they are elected, they answer to you, and they are two types of elected officials who often get a pass on this issue. They don't want people to realize that they have control over.
Wait, who started the recording?
Not
Stop.
me.